Ο κύριος Κωνσταντίνος Πάντος, γνωστός χειρουργός, δυναμικός χειρουργός. Άνθρωπος που δίνει απαντήσεις σε πάρα πολλά ερωτήματα που αφορούν στην γενετική. Είναι PhD ιατρός, γυναικολόγος, επιστημονικός διευθυντής της Κλινικής Γένεσης Αθηνών, υποβοηθούμενη αναπαραγωγή.
Dr. Pantos Konstantinos, gynecologist, scientific director of Clinical Genesis Athens, assisted reproduction.
I would like to thank the organizing committee for inviting me here today to address the use of knowledge in medicine and in the field I work in, which is human reproduction. This incorporates the use of genetics. Medical practice and knowledge of medicine know no borders. In our days, educational programs, cooperation between institutions and professionals, exchange of ideas for the mutual enhancement of science, transfer of patient information, public awareness are no more confined within borders. So this includes the cross-border movement of couples who seek help elsewhere in the context of what some may call medical tourism. In recent years, the field of genetics has undergone rapid change and development. Genetics is an area of medicine with enormous medical, social, ethical, and legal implications. The areas of gene therapy and genetic engineering, plus the development of new technology, have represented possibilities inconceivable only decades ago. The Human Genome Project opened new spheres of research. Its applications also proved useful to clinical care by allowing physicians to utilize knowledge of the human genome in order to diagnose future disease. Because of this, genetics has become an integral part of primary care medicine, whereas at one time medical genetics was devoted to the study of relatively rare genetic disorders, the Human Genome Project has established a genetic contribution to a variety of common diseases. Genetic testing, especially during pregnancy, should be offered as an option. In cases where no medical intervention is possible following diagnosis, this should be explained to the couple prior to the decision to test. In recent years, with the advent of IVF, genetic testing has been extended to pre-implantation genetic diagnosis of embryos. This can be a useful tool in cases where a couple has a high chance of conceiving a child with genetic disease. Since the purpose of medicine is to treat, in cases where no sickness or disability is involved, genetic screening should not be employed as a means of producing children with predetermined characteristics. Genetic screening should not be used to enable sex selection unless there is a gender-based illness involved. Similarly, physicians should not countenance the use of such screening to promote non-health-related personal attributes. Genetic testing should be done only with informed consent of the individual or his or her guardian. Genetic counseling is generally offered prior to marriage or conception. It is done so in order to predict the likelihood of conceiving an affected child and in order to determine the condition of the fetus as well as the susceptibility in certain disease. This is especially true for individuals at higher risk for conceiving a child with specific disease. In addition, adults at higher risk for various diseases such as cancer, mental illness, or neurodegenerative diseases in which the risk can be tested for should be made aware of the availability of genetic counseling. Because of the scientific complexity involved in genetic testing, as well as the practical and emotional implications of the results, the WMA sees great importance in educating and training medical students and physicians in genetic counseling, particularly counseling related to pre-symptomatic diagnosis of disease. So the WMA acknowledges that there can be very complex situations requiring the involvement of medical genetic specialists. In all cases where genetic counseling is offered, it should be non-directive and should protect the individual's right not to be tested. In cases of counseling prior to or during pregnancy, the prospective parents should be given information to provide the basis of an informed decision regarding childbearing, but should not be influenced by the physician's personal views in this matter, and physicians should be careful not to substitute their own moral judgment. It is currently possible to undertake screening of an embryo in order to provide stem cell or other therapies for an existing sibling with a gender disorder. The ninth statement of the European Society of Human Reproduction Task Force on Ethics and Law considers ethical questions and specific dilemmas concerning pre-implantation genetic diagnosis for human leukocyte antigen typing of embryos, HLA, screening. This application is particularly complex because the interest of the sick child needing a transplantation should be balanced against the interest of the future donor child, who may result from the technique. It is concluded that if the parents intend to love the child, the creation and use as a donor is not inherently disrespectful. In today's world, we are witnessing a rapidly decreasing cost in the sequencing of human genome. The complex interaction between patient education, social regulation, reimbursements, healthcare providers, privacy ethics committees, research and development incentives, research protocols, and intellectual property rights all lead to the individualized and personalized medicine approach, irrespective to where one resides. Also on the movement are doctors with no borders. They are physicians who rise from the needs of times. They are useful and necessary for times of wars, epidemics, earthquakes, and natural disasters. Their mission and task being the transmission of medical knowledge and methods, always in the context of social acceptance. Today we live in an era of globalization, and cross-border movement of couples is an inevitable fact. It is a term used for people seeking infertility treatment beyond the boundaries of their country in the context of what we may call medical tourism. Only in the United States for the year of 2014, an estimated 1.2 million Americans traveled abroad for medical care, and it's estimated that 4% of Europeans will receive medical treatment in a country other than their own. According to estimates by 2020, there's going to be a significant increase of visitors to our country for health services. Furthermore, cross-border medical care is encouraged by European Union policy plans and has been established by the Community Directive 24/2011. So, infertility is an unexpected and dramatic event for couples who bear it. Its effects are so profound that it has all sorts of consequences, social, economic, and psychological for the couple, but even in the extended family. And to present the issue of infertility in its real dimensions, according to recent data published by the European Society of Human Reproduction, more than 500,000 IVF cycles from 31 countries, European countries, in 991 IVF units, including Greece, were performed in 2010. In Greece, there are an estimated 12,000 to 14,000 IVF cycles, in vitro fertilization cycles, performed annually. So many couples seek solutions to reproductive issues that cannot be resolved in their countries of residence. There are several reasons for couples crossing international borders for treatment, and these include previous IVF failures in their own countries and legal restrictions. Couples crossing the borders demand a high quality of service, high success rates, and take into account the accessibility of fertility treatment, the facilities of IVF, the cost of treatment, though this seems to have the least impact on couples' decision to choose an IVF unit abroad. And one may ask, why choose IVF in Greece? And the answer is proven expertise in assisted reproduction, financial reasons, as the cost of IVF is lower, 4 to 5 times lower than the United States, progressive legislation in Greece, whereas legislation restrictions apply in other countries. Greece is also a favorable holiday destination due to an abundance of islands, favored climate, beautiful scenery, and best beaches within a wealth of archaeological and historical sites. And as such, Greece could be an obvious choice for IVF abroad. So in the next few minutes, I will show you how Greece has become a destination in this field of medicine. For the progress we have done in IVF and our achievements in the past years, the constituents of success seem to be 3: scientific, clinical, and business. Elaborating on the scientific, we have research projects and scientific inquiry leading to advancement in this field of medicine. Here we see the hatching blastocyst, which is an embryo, approximately 250 to 300 cells, which even before it hatches is trying to communicate through an unknown as yet process with the endometrium in order for successful implantation to ensure. And as the embryo hatches, it is sending out signals of the type, is there anybody out there? And as we see in these electron microscopy pictures of blastocysts from our lab, which will soon for the first time be published, the embryos are indeed communicating. The barrel-shaped structures seen on the surface of the embryo at various stages of formation seem to contain fluid with chemical factors that apparently represent the language of the embryo. It is seeking to communicate even as we culture it in our laboratory. And researching and recognizing this embryo-endometrial communication is what scientific inquiry is all about. Once we uncode this language, it will be a whole new leap in the history of IVF. So returning to the constituents of success on the clinical, we have a commitment to improve the quality and efficiency of IVF treatments, as indications now tend to cover every possible cause of infertility. Even further, we are now witness to IVF expanding to the greater population of fertile couples, providing solutions associated with genetic origin. So what have we done? Our center was founded in 1995 with the vision to provide highest quality personalized care to IVF couples, and by offering state-of-the-art medical technology, has through the years evolved to become the largest private IVF unit in Greece and one of the busiest in Europe. So our scope is to investigate people's problems and ensure that the least invasive and more cost-effective treatment are pursued. We make sure that we meet these demands by taking an individualized approach to each and every couple. We plan every time a customized IVF procedure tailored to the specific needs of the couple. Build our profile on the basis of research and new technology development. And as Aristotle once said, quality is not an act. It's not an act, it's a habit. And the practice of medicine has always been about each individual patient, and clinicians have long observed that different patients respond differently to medical interventions. The once applied approach on one-size-fits-all treatments has now changed to a more pragmatic approach, predictive, preventive medicine on an individualized basis. Our research and application of blastocyst biopsy has led us to many successes and world's first. In 2005, we applied the first blastocyst biopsy for the diagnosis of beta thalassemia in conjunction with the genetic lab of the University of Athens, which led to the first published report on live birth of such a healthy infant. Furthermore, we applied for the first time in Greece pre-implantation genetic testing and simultaneous analysis of histocompatibility in 2005 in order to save a child suffering from chronic granulomatosis disease, and this was published as world's first. And it drew a lot of media attention in Greece as it was realized that IVF technology not only helps infertile couples, but can also save lives and heal sick children from fertile couples. And of course, this drives us to a different kind of future, because the boys suffering from chronic granulomatosis disease, having blood from stem cells of a girl, will have a girl's DNA circulating in him. And as his mother so happily mentioned, this detail may one day save her son from jail, because if he ever commits a crime and leaves some blood behind with DNA analysis, everybody will be looking to find a female criminal. In addition, through international collaboration with Monash University in Australia in 2006, for the first time we investigated and identified the genetic profile of embryos associated with implantation and success in IVF. The results of this study were published in Human Reproduction Journal, drawing significant international attention with over 92 media citations around the world, including this Reuters report, which enabled us to be included in the history of IVF, a site where all pioneer IVF units are mentioned. In this site, we are mentioned not once but twice for our pioneering research. The last of the constituents necessary for the promotion of reproductive tourism is the business aspect, where agreements and partnerships between health professionals, from different countries facilitate cross-border movements. Of great importance are educational programs that are exported abroad. Following the receipt just mentioned and having provided you with some of our scientific research and implementation, I will give you some further examples of what we have done, such as the CNN report on the birth of a healthy child after the application of PGD for a couple living in northern Greece who carried a mutated gene for Leber congenital amaurosis, which causes blindness and who already have 2 blind children. And as you can see from this front page article in the Sydney Morning Herald from Australia, a success carries lots of sentimental value and positive publicity for this country. As well as this front page Romanian article on a success story for a couple from Romania with Parthenon in the background. Of paramount importance is proper education for health professionals in the field of infertility. So we made a new beginning and a first for Greece with the affiliation from 2013 of the University of Athens with Genesis Athens Clinic in providing further educational opportunity on reproduction by e-learning program. The aim is to enhance knowledge, to further stimulate research, to provide work experience and employment opportunities for new professionals. This e-learning program, which has theoretical and hands-on modules, has for the first time in Greece been exported to neighborhood countries. An agreement already exists between University of Bucharest, Romania, Athens University, and Genesis Athens Clinic for educating Romanian professionals in the field of infertility through the Greek e-learning program, and was officially announced in Bucharest in September 2014 in the presence of both Romanian and Greek ministers of health. The goal of exporting this program to Romania is for foreign health professionals to visit and practice in Greece, enhancing the leading role of our country in IVF and promoting Greece for medical education expertise and medical tourism destination for reproduction. By realizing the expectations and making their dreams come true, we now have infertile couples coming from 34 countries worldwide. The benefits and the harm associated with cross-border reproductive care are long-term, impacting on the shareholders of the assisted reproduction, as well as in the medical, economic, political, and social systems of the local populations and the countries of departure and destinations. As doctors who treat infertility patients from abroad, we have an obligation to offer the same quality of care as required for all domestic patients. As we are heading into an internationalized model of reproductive medicine, we must know our potentials and develop them even more, but we should also know our limits dictated by our morality. So, some final remarks on the use of knowledge. Without materialism, both diseases and therapies will be taken to be purely spiritual. Creativity drives scientific inquiry to solve a question or a problem. Without realism, diseases will be viewed as either imaginary or social flaws. Scientists who work outside or at the edge of community comprehension need to educate and explain. Making a difference is about recognizing the creative opportunity, explaining the benefits, and challenging long-held dogma that frustrates progress for medical benefit to the infertile couple. Thank you very much for your attention.
Ευχαριστώ πάρα πολύ τον καθηγητή τον κύριο Πάντο. Ήταν πολύ εξαιρετική η ομιλία του και πάρα πολύ χρήσιμη για όλους μας.